Good morning, good afternoon, good evening, everyone. Welcome back to the WHO Regional Office for Europe's regular COVID-19 press briefing from here in Copenhagen. I'm joined by Dr. Katie Smallwood, our Incident Management Team Lead, also joined by Dr. Siddhartha Datta, our Vaccine Preventable Diseases and Immunization Program Manager, Unit Lead, and also our Regional Director, Dr. Hans Kluge. I'm going to turn to the journalists shortly, but before I do that, for your questions, I'll pass the floor to our Regional Director.
To date, in the European region, we have 55 million confirmed cases of COVID-19 and 1.2 million deaths. That's 32% of cases reported globally and 31% of all deaths. Overall, for 2 consecutive months, we have seen a decline in terms of cases, hospitalizations, and deaths. A total of 368,000 new cases were reported last week, a fifth of the weekly cases reported during Europe's recent peak in April this year. For the first time since last autumn, new deaths dipped below 10,000 last week. As of this week, some 36 countries out of 53 are easing restrictions due to declining COVID-19 cases. Whilst we should all recognize the progress made across most countries in the region, we must also acknowledge that we are by no means out of danger. With increasing social gatherings, greater population mobility, and large festivals and sports tournaments taking place in the coming days and weeks, WHO Europe calls for caution. COVID-19 notification rates show that widespread community transmission continues across the region. The new Delta variant of concern, which shows increased transmissibility and some immune escape, is poised to take hold in the region, while many among vulnerable populations above the age of 60 remain unprotected. We have been here before. Over the course of last summer, cases gradually rose in younger age groups and then moved into older age groups, contributing to a devastating resurgence, lockdowns, and loss of life in the autumn and winter of 2020. Let's not make that mistake again. Today, WHO Europe is launching a campaign together with UNICEF to encourage everyone to exercise caution, reduce risks, and keep safe from COVID-19 while enjoying the summer. If you choose to travel, do it responsibly. Be conscious of the risks. Apply common sense and do not jeopardize hard-earned gains. Remember, wash your hands frequently, keep a distance, choose open settings, and wear a mask. Avoid the 3 C's, settings that are closed, confined, or crowded. It will put you at high risk otherwise. As vaccination coverage increases, we need to stick firmly to protective measures to suppress the virus. This needs to happen even as cases decline. A combination of public health measures and vaccination, not one or the other, is the way out of this pandemic. Just as in 2020, cases have declined as we enter the summer period, but it is no time to cut down on the public health response to COVID-19. If we are to avoid another resurgence after the summer, we have to take last year's lessons aboard. Act fast on signals of increasing cases, expanding testing and sequencing, stepping up contact tracing, and rapidly attaining very high vaccine uptake in the most vulnerable populations. By doing so, we save lives and livelihoods and bring the pandemic to an end sooner. In 6 months, more than 400 million doses of COVID-19 vaccines have been administered in the region. This summer, vaccination needs to happen at a much faster pace. As of today, 30% of people in the region have received at least 1 vaccine dose, and 17% have completed their series. Although we have come far, we have not come far enough. Vaccination coverage is far from sufficient to protect the region from a resurgence. The distance to go before reaching at least 80% coverage of the adult population is still considerable. We should also remember that being vaccinated does not automatically stop us from becoming ill or spreading the virus. Vaccination does, however, reduce the chance of becoming seriously sick or dying from COVID-19. I therefore urge you to get vaccinated when it is your turn. Our understanding of the safety and efficacy of vaccines amongst adolescents and children continues to evolve. For sure, children can be transmitters of COVID-19. However, the risk of severe disease or death is up to 800 times lower than someone who is aged 70 years or more. Our urgent priority should therefore continue to be to protect the elderly, people with comorbidities, and our frontline workers. These groups remain unprotected in a number of countries in the region. Protecting vulnerable groups to minimize deaths, alleviate the pandemic's impact, and suppress the virus hinges upon equitable vaccine access. We all have a role to play. Keeping everyone safe is everyone's responsibility. In closing, once again, I call for leadership across the region to commit, above and beyond words, through action, to pan-European solidarity. Thank you.
Thank you very much, Regional Director. Right, I would remind you, please do raise your hands in the system if you'd like to take the floor, and I will turn to you for your questions. I already have one from Cristina Giuliano from Asca News in Italy that we've been sent. And the question reads, we are at the start of the summer. Are the WHO worried about European countries such as Italy, which relax their measures for the holiday period? So, Regional Director, maybe, and then I'll go over to our Incident Manager, Dr. Katie Smallwood.
Thank you, Christina. First, I would like to empathize with the people that you're really looking forward to the summer and to enjoy the summer. But the key issue is to enjoy safely. Because I was mentioning in the statement, we have been there before 1 year ago. And that's why WHO with UNICEF is launching the campaign Summer Sense. Use common sense. If you want to travel, think about the needs, and if you decide to travel, do it safely. Adhere to the 3 W's. Wash the hands, watch the distance, wear the masks. If you gather with quite a number of people, do it in the open. And towards the governments, continue to open up societies in a gradual, safe way. Take the time when it is a better epidemiological situation to further increase your testing, sequencing, contact tracing, hospital capacity to be ready and learn the lessons from last year. Thank you.
Thank you. Katie, would you like to add anything to those points by the Regional Director?
Thank you, Rob, and thanks for the question. Honestly, I think the Regional Director has said it all, so I have nothing to add.
Great, thanks very much. Okay, next I'm going to go to, I can see Maria Cheng from Associated Press is with us. Maria, please, the floor is yours.
Hi, thank you very much for taking my question. I appreciate it. I have a question about US President Biden's announcement yesterday that the US will purchase 500 million doses of the Pfizer-BioNTech vaccine, of which 200 million will hopefully be given to countries through COVAX later this year and the rest next year. I wondered if Dr. Kluge could comment on how significant that is and how far does that go to addressing the vaccine equity issues that you've talked about previously. Would you rather see countries donate vaccines now? Could you just put this in perspective? Thanks.
Thanks, Maria. It's a very important announcement indeed. 500 million vaccine doses to COVAX to distribute to 100 countries. Let's remind what our WHO Director General, Dr. Tedros, mentioned recently, that we need about 10% of the population of all countries covered by September and 30% of the population of all countries by December this year. For September, this would mean 250 million doses extra, but particularly in June and July. So to answer your question, we need indeed the doses now. It's not only a matter of money, but the actual vaccine doses. So we welcome this very much. Of course, we're very much looking forward to announcements by the forthcoming G7 summit, because they do have a tremendous economic power to help the world getting out of this pandemic. But at the same time, we need to look for long-term sustainable solutions to fully fund the COVAX advance market commitment, and as we discussed a number of times, to really drastically scale up the vaccine production. But of course, it's very hopeful. Thank you.
Thank you, Maria, for the question. Thank you, Regional Director. I'm next going to go to Gunilla von Hall from Svenska Dagbladet. Gunilla, good morning.
Yes, can you hear me?
Yes, please go ahead. Thank you.
Yes, thank you. I'm sorry, I just came in a bit late on the press conference. I hope no one asked this before, but I have a question on this Summer Sense campaign that you're launching. What makes you launch this now? You're saying if you can postpone your travel during the summer, it's the right thing to do now. Why are you saying this now? What is worrying? Is it the variants? And don't you think it is a bit late to come with a campaign like this now, when people have already made a lot of their plans for the summer travels in Europe? Thanks.
Thank you very much, Gunilla, and welcome back. Regional Director.
Thanks, Gunilla. So a key word is pragmatism. So people have been suffocated for quite a long time. We're very concerned about mental health issues and well-being. So in that sense, people are making plans. So we need to do it all, right? First and foremost, I call it, in fact, a VIP approach, the V from variants. Yes, we are very concerned because in a number of countries, the Delta strain variant of concern has overtaken the Alpha one, and we need to beef up sequencing. So that's the V. The I from immunization. We need to further drastically scale up the vaccination part and also overcome in a number of countries vaccine hesitancy. And then there is the P from politics, that the politicians to further base their decisions on sound scientific epidemiological data. Because we have this seen also before, right, that the science was not always in the lead, and we should take this lesson. So the campaign is rehearsing somehow the key messages we have been giving all along and to appeal to the common sense of the people.
Katie, can I ask you to add a few points, please? Thank you.
Thank you very much for the question, Gunilla, and just to extend on what the regional director said. In some ways, in his statement, he made it clear we've very much been here before. We entered the summer last year with cases going down. Countries are now taking measures to lift travel restrictions, to open up societies. This will result in more travel, both domestic and international, more population movement, and more gatherings. So we do know from last year that over the course of June, July, and into August, cases rose, especially in younger age groups, gradually, very gradually. And learning from that, and given that we have a particularly concerning variant that is not yet prevalent in the European region, but in some countries has already displaced the Alpha variant, which is the predominant variant in the region, and will take advantage of any opportunity it has to spread very quickly. We've seen very significant evidence of significantly higher transmissibility in that variant. We've seen initial basis for increased risk of hospitalization, and we've seen some evidence of immune escape, especially after only one dose of vaccine. So in the current situation, our assessment is that this does pose a significant risk in the current context in terms of community transmission and in the context of the significant variation in the uptake of vaccines among over 65s and vulnerable groups. So we do see a risk of a resurgence of cases. And that's where the Summer Sense campaign comes now as people are taking decisions. They still are, because people have delayed decision making to wait for what rules governments put in place. And it's our opportunity now to reach out to communities and rely on the common sense of people to make good risk-based decisions and personal choices. At this moment, 18 months in, a community-led response to COVID-19 and the pandemic is just as important as the decisions that governments take. So we really will rely on those decision-making over the coming months. And given that we're at this stage now, we feel the need to re-emphasize and provide information and tools to people as they're making those decisions and taking their own decisions based on their own personal risks. Thank you very much.
Thank you, Katie. Siddhartha, would you like to give us something from the vaccination aspect? The regional director referred to vaccination, but also vaccine hesitancy. Could I ask you to chime in here? Thank you.
Thank you, Rob. Thank you, Gunilla, for that question. And I think in continuing where Katie left, and I think if you, as we see since last year, our WHO's advice had always been around, the gatherings and how people can avoid as much as they can. But vaccination, understanding of vaccines, effect of vaccines on variants, and the increase in vaccination uptake has been a phenomenon that WHO has been following very closely. These all knowledge also played a big role in ensuring that this advice or the suggestion to the community in general is apt at this point of time. More and more vaccines are becoming available, and this is also providing that additional tool in our toolkit to bring an end to this pandemic. While vaccination has been talked about in a community, it's also important that these messages around do it all, as you have heard from the regional director, is making real good sense now to put it back up in the discussion. And I think bringing in the issues around people's perception around the vaccine and ensuring that the community understands that vaccine is important. We have heard from the regional director in his initial address that when opportunity comes, people need to come forward to get the vaccines. The people's perception need to be addressed while ensuring that the vaccination uptake goes high. So I think this is an apt moment to bring all these components together in one campaign. Thank you.
Great stuff. Thanks very much. Now, we have a question from Emin Aliyev from Report AZ in Azerbaijan. But before I get to that, please to remind you, the journalists joining us online, that you can raise your hands if you have a question, or I've just opened the chat box. Also, we've now got access to that. If you have a question, please do type your question into the chat box and I'll see it here and read it out in case you can't raise your hand in the system. So to Amin's question from Azerbaijan, latest reports say that you will visit, and this is to the regional director, latest reports say that you will visit Azerbaijan as part of your regional trip. Could you please share with us the exact dates of your trip to Azerbaijan? Will there be any meetings in the country? And if yes, who are you going to meet with? What topics are going to be discussed here? Regional Director.
Absolutely, Emin. Recently, we had the video conference, Dr. Tedros and me, with the president, the head of state of Azerbaijan, who welcomed me very much to the country. So I'm very much looking forward. Dates are currently under discussion, I hope in the near future. Country visits are fully in line with my vision for health and well-being in the region. The vision is called the WHO European Programme of Work, and it's all about country impact. So going to the countries really gives the best opportunity to look at the opportunities, the challenges, and referring to your question, to meet the head of state, head of government, my direct counterpart, the Minister of Health, who in the case of Azerbaijan, as you know, is a new Minister of Health. Very much looking forward to meeting the new minister and expressing also my gratitude to Professor Oktay Shiralev, the former minister who has done an outstanding job. And then I always take it a point of attention to go also to primary healthcare facilities to reach also the vulnerable people and talk and observe, because that's the best way to reform WHO and to ensure that we are people-centered and really helpful to the countries. So I'm very, very much looking forward. Thank you.
Thank you. Thanks for the question and thanks for that response. I will next go over to David Williams from the Xinhua News Agency. David, welcome back. Can you hear us? David, I can see your hand is raised. Okay, I think we've lost him. I hope we've still got connection to the other journalists. I believe that's all the questions that we have at this point. I don't see any other hands raised or any other questions in the chat function. So it only remains for me to thank the panelists today. We'll be sharing our Regional Director, Dr. Kluge's statement and further information on the Summer Sense campaign. The recording of this briefing will also be online soon. So thank you very much for you all joining. And as always, please stay healthy and take care. And thank you once again for joining us today. Goodbye.